So today we have a lecture about the use of herbs in topical applications. So we're going to talk about varicose ulcers and the rubefacient herbs, the vulnerary herbs, the herbs that are used when applied topically to draw blood to the area, to bring white cells in to deal with infections, to improve skin repair, deal with localized inflammation. And we're going to base this on a case report and a discussion of the materia medica that was used in that case. So this is actually from quite a long time ago in my practice. This was a gentleman who presented in the clinic in 2001. He was 79 at the time, and in July of 2001 is when he came to clinics, about 6 months prior. He'd had an injury to his left shin. He was not interested in using herbs to treat those underlying conditions or to address the drug dosage. I suggested that we might be able to minimize some of those drugs, change some of them out for herbs, monitoring closely, at the very least, the blood pressure ones. I thought we could probably work on that quite successfully. Might have offered him lily of the valley instead of digoxin at some point along the way, but he didn't go for any of that. So what was the clinical plan? So what I wanted to do was to improve the circulation to the periphery. So I wanted to get more blood delivery to the lower limbs. Of course, the corollary of that is more blood return. It is, again, as I said, used for treating mucous membranes, even called the king of the mucous membranes, although that wasn't the purpose for us in this formula. What I was wanting it for, again, was the astringent antimicrobial properties. So we simply put the powder into the poultice, but you could be using this as an eye wash, a mouthwash, a douche, an enema, and of course taken orally. Well, I would put comfrey in the poultice. I would use gotu kola and butcher's broom in the tincture, and I would use hawthorn in a tea rather than the tincture. Research in Germany in the Commission E monographs, they report increase in venous tone, anti-phlogistic. That means to remove congestion from tissues.